Okay. So again, I'm Annie Kirk. I'm with our communications team here at Public Health, and we're really happy to have you with us for our April Public Health Partnership call. And I will pass it over to Matthias. Matthias, if you could introduce yourself, um, and then we'll get started sharing some information. And for everyone on the call, once you're feeling settled, if you can add your name and the organization or the program that you're with into the chat, that's just helpful for us to have a sense of who is here. So Matthias, I'll pass it to
Great.
you.
Okay, thanks, Annie. And similar to Annie, I'm stepping in here. I know Annie is often in this calls as Justin facilitates, but I'm helping to support too, as we're a little bit short-staffed now. But really happy to be here. Matthias Valenzuela, he/him pronouns, Director of the Office of Equity and Community Partnerships. So I work with Justin. We're part of the same office, and sitting just right across the the wall here from Annie, and it's good to see everybody. I see a lot of faces and names that recognize. So hope everybody's doing well. And happy April 1st. Haven't had any April Fool's jokes yet. So if anybody wants to sneak anything in here during the meeting, we'll take that too. So. Should we go ahead and go through the slides? All right. So we're going to do, and it's kind of interesting. You're going to, I see who's in this meeting, and some of you all are going to actually see yourselves in a photo even as part of this. But just wanted to use this as an opportunity to talk about our King County Community Health Improvement Plan. Just an overview of it, and also how to get involved. Really important. It's an effort that we launched last year, but there's really we're just getting going. As you can see here, it's a 5-year plan, so there's plenty of opportunities to continue to be involved. And we'll be providing an overview and then also some resources and information on how to get involved. If you could go to the next slide, that'd be great. And a CHIP. What is a CHIP? The Community Health Improvement Plan, I will often refer it now to as a CHIP. And Vicky, I see you're in the meeting and you're also in that photo. And I think others of you are in the photo as well here. So the actually community health improvement plans, we have not in public health had a CHIP before, a community health improvement plan. It is really a sign of I would say a highly qualified and top health department if you do have a CHIP. Um, it is really focused on a more long-term systematic effort using what's often called a collective impact approach. So you actually have a backbone organization. In this case, it's public health, and you create a plan and a shared implementation plan that is moved forward by a community as a whole. So even though we, as a health department, we are facilitating the process, it really depends on the participation and actions of everybody who is involved. A lot of data has informed the process, both qualitative data, which are the voices of community, like many of you who have contributed to informing the plan. And also we looked at a lot of health data. In many of the meetings, we started off with a large number of potential topics and issues that we wanted to focus on. And then through conversations and by looking at where we could make some of the biggest impacts is where we ended up having our more focused priorities. It is really developed by community. So the plan itself and the words in it are words that have been developed really in these meetings with community partners, also with the steering committee. We're trying to promote the health more broadly. And it's not necessarily it's not a funding stream. It's not a new program per se. The big part of what we aim to do with the CHIP is to learn, align, reduce silos, and to collaborate. I can imagine many times we're in a space and we say, hey, this team and this group should be talking to these other folks. I can't believe people aren't talking. And so this is a space, a broader umbrella where different people can come together and organizations can come together to really jointly improve the health of the county in some of the areas that are considered most critical by community. If we go to the next slide. This is the timeline that we've been following so far. We started now close to a year and a half ago with a steering committee that initially began to develop and work on some of the mission, vision, some of the priorities, looking at the data, the community health needs assessments, for example. And then we've had these partner meetings that eventually worked on the plan and developed the plan and then led to the launch in October 2025. What you see on this, it's a very democratic actual process. When you see one of the images I love is those voting totals. And those are actually, each of those items that was voted on are things that really had bubbled up. We started with many different topics, but then got down to 6 top topics. And then we did have a couple of meetings where we ended up really seeing where we needed to prioritize. And I think the key, it's very small there, but and you'll see, I'll provide more details into each of these areas. But one of the areas is housing and homelessness, and the other one is income and employment. So the wonderful thing about it, though, too, is these aren't typical what we consider, health programs or services, but they're very much major drivers of health. When we think about the social drivers of health, the determinants of health, these are actually both income and employment and housing and homelessness are really major determinants and contributors to, how healthy we are, how long we live, whether we're more likely to be sick or infected by a communicable disease or to have a chronic disease. So these are just important drivers. So it's important that we're not just thinking about at the service level, but trying to address some of the bigger issues that impact health outcomes. If we go to the next slide. This is the mission, vision, and values that everybody in the group, including some of you, came up with, and really looking at short, mid, and long-term solutions that use this collective impact approach and trying to address really the complete well-being of people in King County. Importantly, this is reflected in the values. It's really focusing on equity, anti-racism, and social justice, but using some of the things that I've already been mentioning around just really breaking down those silos in terms of collaborating, building trust, and then also building accountability. So actually, as part of our plan, and I will share some of the goals that we have in there. We are tracking and going to be reporting regularly on the work that's happening and what are some of the areas of progress that we may have made, or also areas where we see that we need to be focusing on and maybe addressing in the future. Go to the next slide. So why is this different than other coalitions or committees? Because there's a lot of groups out there, and this is really we're seeing it more around, it's a broader health equity movement and really bringing different partners from across the county. Even as we launch this, other folks have really been attracted to it and coming together and trying to support it too, because it's something that really resonates and they want to be a part of, really together building power and a commitment and opportunity to work together with this collective approach. It's also an opportunity. There's a lot of things that are working. If you think about income and employment and housing and homelessness, it's a way to actually amplify, take some best practices and see whether they can be replicated throughout the county, whether can be replicated and expanded by other organizations. Really, it's very a transparent effort. It's a table that is open to anybody who wants to be involved, and really trying to also kind of reduce sometimes the silos or redundancies that often exist when folks work on things like this, that people say, oh no, somebody else is doing something similar over there, you should be able to work together. So we don't own the work per se. It's just an umbrella for folks to come together and be a part of this. We go to the next slide. So this is getting into some of the specifics around the two goal areas. So we have two work groups, actually three work groups, two goal areas, and then another group that works across both areas. So we have one of the goals is around income and employment, and the group collectively, and these are dozens of people working through multiple meetings, said that we are really aiming for living wages with upward mobility that covers universal healthcare access and educational access. So this is a lot happening around the relationship building. By 2030, we want to build relationships, build momentum, and share resources to enhance collaboration and sustain collective CHIP implementation. And you can see the broad set of partners that have committed to this. Right now, we have work groups from these different sectors. Healthcare, Native Indigenous organizations, CBOs have been part of this work and really supporting that objective A. And objective B is that by 2030, we will strengthen the workforce to make it easier to find a living wage job and build careers. So a lot of work there on identifying gaps and connect employees with resources, and then also training education support that centers communities. And you can see similarly some of the organizations that have been involved around housing and homelessness. It's housing for all, regardless of family size or affordability, and recognizing housing as a human right. So we really are aiming also by 2030 to advocate for housing-related resources in Central King County communities to support access to healthy, stable, and high-quality housing. And you can see the set of organizations there working on that. And then by 2030, we want to build relationships to reduce siloed efforts and maximize collective impact by identifying and actively joining existing coalitions focusing on housing programs, policies, and investments. So those are the areas that those two groups are focused on. There is a third group that has been meeting, which is relationship building that cuts across both of this. So that work group is really kind of setting the table for folks to come together and also recognizing how important those relationships are. And to have a strong CHIP, you need to be a strong convener. So there is a group that works across both of these areas and is really focused on building relationships and doing presentations. We've done presentations around this to all kinds of bodies, from to Board of Health to community coalitions, and many different groups that are interested in this work. If we go to next slide, and this might be the final slide here, and this is just how to get involved. Of course, it's the table is open. It's for it's continuing to evolve, but it's open to anybody to be involved. We have a the CHIP website with kingcounty.gov/CHIP. You can join one of our work groups. As I said, we have three work groups. There's employment and income, there's homelessness and housing, and there's relationship building. They meet, each of those meets every 2 months. So attending one of those, and usually the meetings are both in person and online, so they're hybrid. So there's but I think that one meeting just happened this week that was just only online. So there's multiple ways to get involved. If you email the community health improvement at kingcounty.gov, that's the main email for our CHIP, and that's a way to make sure that you join our mailing list. And then the other thing, if you get the newsletter and are part of our mailing list, you'll be hearing about all the different resources and all the events and all the activities, and also all of the work group meetings that happen. And we are having our next, we haven't done this since the launch, where we've had a lot of people present. We've had only some of the smaller work groups meeting, but we have our next large convening is going to be on June 9th. So save the date. And also that information is coming out through our newsletter. So I'm also going to put my email in the chat in case, and I'll put also the newsletters there too on the chat so you have more know how to contact us. So you can send it to that email, community health improvement at King County, or you can email me and we'll make sure that you're added to that newsletter. So thanks. We'll send it back to you, Annie, to see if anybody has any questions or comments. Also, a lot of folks in this group have been part of the effort. So also would love to hear if you all have anything you want to say around the chip itself, the process, or even if you've been active in one of the work groups, how that's going.
Yeah, thank you so much, Matthias, for sharing the overview. And as you said, we know many of you here in the group have actually been a part of this work, often from the very beginning. So I don't know if anyone has anything that they wanted to add or reflections on this process. And thank you, Matthias, for putting those links in the chat.
I'll share a little bit. This is
Mm-hmm.
Cynthia.
Yeah, thanks.
I've been to two of the meetings, the income and then the what was the last one? Bringing them all together.
Yeah, relationship building. So
Yeah, thank you.
Yeah,
Thank
yeah.
you. And I think I'm actually starting to see it come together. And I was there from the beginning when we didn't have these small groups, so we were in one big group. And I'm actually seeing it come together and spread wider because I've been in several meetings where CHIP has been mentioned and what they're trying to do. And right now we're kind of all talking about asset mapping and how that's coming together and going to work. And I'm just really anxious to see um, what the asset map brings. And I'm hoping that it's like a step beyond 211. 211 is just this pool of resources, and you have to call this place and go this place and do this, and maybe they'll have this, but they'll send you over here. But that this asset mapping will be a place where people can go and actually receive the service, like connect direct to the service. Um, and it may be a matter of, this particular uh, agency doesn't quite have what you're looking for, but they know where to send you to get what you need and that people's needs are being met. Because that's what I'm hoping, that we get some end results. And I like the way all the groups are doing different things, but when I popped into the groups, we're really talking about the same thing coming together. And so I think that's going to be really good in the June meeting. I'm excited to see how that all comes together. Thank you.
Great. Thank you, Cynthia. Also appreciated your participation as part of this. So really, really important. And I see Vicky's hands too. And I think the other thing that's kind of going to be has been interesting I've seen is like we've been thinking about some of these systems and things, but then I'm hearing a lot of interest for people to get just some resources to be able to share on these topics of income and employment and housing and homelessness. Just being able to have some resources to share with community, right? Because a lot of folks that are part of this effort are working directly or service providers or as part of community-based organizations. Vicky, I see your hand was up.
Yeah, I just want to share I'll just say this, the connectivity in the community is really what matters into the work that we do. And it's regarding like whether it's relationship building, and also for us who work you know, on the field, and learning and seeing and feeling our community, and then bringing what we're also um, seeing what we're feeling and also bringing that to the table, and then how we can meet our with the teams to share what we're seeing and feeling, and then also working with directly with partners to see what's best in the work that we do that we can implement uh, to bring change. So this, what I'm seeing here from, here is to really connect with other programs and services. Is that's the reason why we're here. That's why programs were implemented, because there was a need at one point. I always continue to say this because we know that we want to help our fellow community, but we also want to assist with partners who may not have the capacity, right, to do outreach, to be able to connect with community. But with all of us together, we'd be able to support one another in the work that we do. Thank you.
Thank you, Vicky, for that too. And you're one of the people that is in one of the photos too for the CHIP plan. So you've been very active. Thanks.
Did anyone else have any questions or anything that they wanted to add, either about their experiences with CHIP so far, or just any questions that you have for Matthias? Elizabeth.
Okay. May I ask one question?
Mhm.
First of all, I highly appreciate for this informative information. I want to know, is this program have a relationship with foundational community support services, which is which is now on through the other program? Is this program has a relationship direct or? Thank you.
And I heard the foundational community support services. Is that what I heard? I'm not sure. I don't think there we are connected. So if there is a need to make some of that connection, would love to know about that. And maybe be happy to reach out.
Okay.
Yeah, personally. But yeah, thanks for sharing that.
Last time I took a training on foundational community support program, which is just considering housing as a shelter, other job opportunity, just combining both as a public health determinant, so that if we can address the housing, employment, we can also address the health issue, which is have an interrelationship. Thank you.
Great, thank you. I also want to point out one person I just saw join is Scott Pinkham from United Indians of All Tribes Foundation, and who's also part of our CHIP steering committee. So he could have also done some of this presentation as well. So
okay,
thank you all.
Hi, Matthias, and thank you for the space. And I just want to share like how beautiful that CHIP model was in really centering community. I really love the approach where community being like at the heart of the work and being valued, where all like at the like what I like is that the practice where public health is providing the space and moderating the effort and the communication for community. And that's what I really love about CHIP. It's like led by the community, value the community, feedback and direction. And it has such a wide representation of the community that is served and we work with in King County. So I appreciate that, and I wanted to acknowledge that. Thank you.
Thank you, Mohammed Akmush, for those words and also for your enthusiastic participation as part of the CHIP. It was really valuable, all your contributions.
Great. Well, Matthias, thank you so much for your time to share an overview about the CHIP. And thank you all here. I know many of you participate. We have the information here if you're interested in learning more or getting involved. But as others have said, it's a really great community centered project, bringing everybody together over the next 5 years. Um, so we really appreciate all of your work and support of this project. With this, if there aren't any other questions, and thanks, Lupe, I see your note in the chat. We're going to shift to some other timely public health updates that I have for you today. The first of which is something that our teams are working very hard on today, and you'll see new information that's on our website. As of today, we're notifying the public about 2 measles cases among King County residents. Prior to the measles diagnosis for both of these individuals, there was travel to multiple locations within Seattle, Kirkland, and Bellevue. Anytime there's a measles case, you will find the most up-to-date information on our website at kingcounty.gov/measles. The most important thing that we want to share with the public at this time is that if you think that you were exposed to measles, first find out if you have immunity against measles. And that would either be from measles vaccination, the MMR vaccine, or from having a previous infection from the measles virus itself. So if you have any questions on that, reach out to your provider or a healthcare provider to learn more. Again, people who are vaccinated are very well protected, but we're getting the information out now of the various locations where folks may have been exposed. I've included a screenshot here so you have an idea of information that we include on our website from the date, the specific time frame, and you'll see like a wide range of hours at these locations that a person may have been exposed, and then the specific location. The reason that time is so large is that measles is highly contagious and remains in the air for several hours after the person has left the area. So again, when you're looking for the most up-to-date information, and I anticipate that we will continue to be updating this today as we get more information from our investigators, this website is where you will find that information. Is there any question? Do you have any questions at all about measles or these particular cases? We'll be posting the specific information on our blog, the Public Health Insider, as well today. But again, our website, kingcounty.gov/measles, will always have our most up-to-date information. And we appreciate your help in getting these notices out to your communities. In happier news, we have the free Seattle King County Clinic coming very soon, hosted at Seattle Center. I believe this is the 11th year of this clinic that's hosted at Seattle Center. It's happening April 23rd through the 26th. Public Health is happy to be a partner of this annual event that provides free clinical services for dental, vision, and clinical, and then other resources like social work and health insurance navigation each year. We've included a sample of some of the services that are provided under each of those categories. Now, this clinic that happens over those 4 days happens on with a ticket distribution system, which is a first come, first serve system. So each morning at 5:30 a.m. At the Fisher Pavilion in Seattle Center, folks can line up and will receive a ticket to then receive services. Patients are allowed to come over one or multiple days of the clinic. However, each morning we'll need to go through that same ticket distribution system for that lineup. This is a clinic that we're really proud to have available for anyone. Patients don't need to reside within Seattle or King County to come. No identification is required, and it's really for anyone who struggles to either afford or access healthcare and other services. Interpreters are available at the clinic, and it's just a really great community event that is run by volunteers. So the thing, my ask to all of you is to help spread the word about the upcoming clinic if you haven't already. I've included links here of where you can find patient flyers and social media graphics. Those are available in multiple languages so that you can share those out with your communities. This clinic is possible due to the many volunteers who come to work the clinic. So we have professional clinicians who are there. We also have like non-clinical staff who are supporting. And I've included the link that you can share for anyone who's interested in volunteering. There are some roles that they're still looking to fill, either because we like to have multiple people to serve in these areas because the more volunteers we have, the more patients we can serve. And I've included the languages in particular that the clinic is looking for more support. And for any language interpretation, you don't need to have professional experience to be able to support at the clinic in that way. It's primarily navigating to get folks to the different areas of the clinic where they're seeking services. And then there's also for specific like medical information, there's language line services that are also used. So you can learn more about the volunteer opportunities at seattlecenter.org/volunteers. I should maybe go back. Are there any questions about the Seattle King County Free Clinic before I move on? That's a fantastic event, and we're really happy here at Public Health to be able to support.
Annie, can you share any information on possible prescriptions being filled at the event?
Yes, and let me see what I added in the slide. They do have they are able to fill some prescriptions there. I wouldn't have a specific list, but also on the website, seattlecenter.org/SKC clinic, there's an FAQ page as well that might get into those details. But if you have any specific questions on that, I can feel free to email me. And I'll put after I'm done talking, I'll put my email in the chat here and I can get back to you with that too. And one thing I wanted to flag, particularly around vision services, if someone has a prescription that they received within the last 2 years, they can just bring that and skip the exam part at the clinic and get the eyeglasses prescription filled. Usually how that works is there's another date to return to pick up the eyeglasses that are fulfilled through this clinic. Okay. Are there any other questions or anything else I can answer about the free clinic.
Thank you, Anna. It's a good information. Of course, as Ethiopian community in Seattle, we have got flyers and now distributing to our community in Oromo, Tigrinya, and Amharic. Unfortunately, the number of Amharic sheet is now finished. Is there any chance to get additional copy, or of course we can print and distribute too?
Oh, for additional copies of the flyers?
Amharic version.
Oh, directly from the clinic? You know
Last
what?
time I got it, I just filled how Siri shared us. Then I filled the request, and they sent to us and distributed.
Mm-hmm.
Now I left with only Tigrinya and Oromo, where we
Okay.
need more Amharic
More
version.
Amharic. Okay, I just put my email address in the chat. So send me an email with your contact information, and I can loop in the Seattle Center staff who run that to see if they can get you those additional copies. I know the flyers are posted on the website, but if you do want to receive the actual printed copies, then I can connect you with the clinic
Legend, see what I
organizers.
said. You have a backpack. You better put some stuff in your backpack.
Okay. Are there any other questions then on the clinic? I can help with that. Okay. So my email is in the chat. So if you do have any additional questions on that, please let me know.
Thank you.
Mm-hmm. So
Thank you.
the other update I wanted to share is that we have a new video that's posted on our public health YouTube page and being shared in different areas. And it's actually a highlight video of the work that many of our community navigators are doing to help with TB information for King County. We're really happy to have this partnership in getting information out to our communities. So we wanted to share that was recently posted. So you can find that. I've included the direct link, and we'll be sending out these slides in the follow-up newsletter. But you can also find this video and others on our YouTube page, and then I included the short link here as well. And if any of you navigators are on here, or some of those who participate in this program, thank you so much for your work on this very important and innovative program. I wanted to share some upcoming trainings that are happening. Communities of Opportunity has a facilitating training that is coming up. This training is in Spanish, so I've included the outreach information here. The training is happening May 7th and 8th, but we're asking that community members are registered by the 13th of April. So this information is here in Spanish for outreach. And then I've also included the information for anyone who doesn't speak Spanish, but who is doing outreach to Spanish communities. Here it is in English, so you have an idea. Again, this 2-day training is conducted in Spanish, and Communities of Opportunity is just really excited to be able to host this training. So links for registration are included. And again, you'll receive these slides in the follow-up newsletter. So you'll have more information. Additionally, our Best Starts for Kids program is hosting the Infant and Early Childhood Mental Health Summit. That is coming up in May, from May 15th to 16th. And this is available for all King County birth to 5 providers in the area. So I've included links here. Uh, the deadline to register for this summit is coming up on April 24th. Again, I've included links so that you can find more information on the Best Starts for Kids blog. And also they have more information about all of the different breakout sessions and speakers who will be attending this summit. So it's a really great opportunity. If you can help to get out information about both of these trainings, that is very much appreciated. And a reminder, our next Public Health Partnership meeting will be May 6th, Wednesday. Remember, it's the first Wednesday of the month from 3:30 to 4:30, where we come together. We have the email here. And reminder, Justin Jeffrey is out on leave, but my contact information is here. So I'll be able to support. With that, I wanted to open it up. If there are any questions about anything that has been shared or any upcoming events or opportunities that you wanted to share with the group or have us be aware of.
Annie, did you share, sorry, like the video link, please?
Yes.
I would love to see it. I'm excited.
Yes. Yeah, we are too. I'll drop that in the chat so that you have that directly even before I send out the meeting follow-up. And I'll let you know that the newsletter follow-up from today I will be sending tomorrow, because once I get off this call, I'm going back to supporting on some measles response work and getting some things out for that. But I'll grab that link now. Are there any? I think I see. Oh, and Vicki, do you want to talk about? I see that you just dropped something in the chat as well. Do you want to share any information about?
Thank you. Hello, team. I just wanted to share that we have an upcoming providers meeting coming up the 17th. That's happening in the Burien Library, is where we share information about programs and services, and then we learn from one another, and then we get a time to network and be able to have a couple presentations that are coming up. So if anyone is interested to come join us, it's open to all, and please share with your network. This is a way how we can connect and build relationships within the community. Thank you.
Thank you, Vicki. Okay, are there any other questions or upcoming events that you want folks to know about in this space? Okay. Well, with that, I thank you all so much. Oh, thanks, Scott. I see the flag for the UW Spring Powwow is coming very soon, April 11th and 12th. Thank you all so much for coming and sharing your time and space with us. Again, I'll be sending out the follow-up newsletter tomorrow, where you'll have the copy of the recording from today's meeting and links directly to all of the different resources that we talked about. So really appreciate you all. Great getting to share space with you, and we'll see you hopefully in May. So thanks, folks.